now we go to Zarah Sultana.
Thank you, Madam Deputy Speaker. When I challenged the Minister on the disproportionate impact of COVID-19 on Black and minority ethnic groups after the first wave of the virus, the Minister denied that systemic injustice was to blame. This new report shows that in the second wave, Bangladeshi and Pakistani people were 3 times more likely to die from COVID, and that Black and minority ethnic communities as a whole are still significantly disproportionately in critical care with it. Does the Minister now acknowledge that it is systemic injustice that Black and minority ethnic communities face, from higher rates of poverty and overcrowded housing to higher rates of frontline work and barriers to accessing healthcare?
Madam Deputy Speaker, I think it's a really interesting question the Honourable Lady has asked. She says that I dismissed the claim that systemic injustice was to blame, but the fact is we didn't know what was to blame at that time. That was in June, 3 months before my report. And what we need to understand is what exactly we mean by systemic and structural. We have seen the data show that at some point ethnic minority gaps in terms of disproportionate impact completely disappeared. If these are structural issues, that is not what we would expect to see. For example, at the beginning of the second wave, we saw that the disparity between Black groups completely closed. It is incredible to say that people were being structurally racist during the summer and stopped being so during the summer, and then over Christmas, these structural issues re-emerged. That does not explain what is happening. We need to look at what the data tells us. We cannot start from the conclusion that we want this to be systemic justice so that we can continue to move from a political, ideological perspective. We're using a scientific perspective. What does the data tell us? And the data is telling us that this is a very complex situation. There are many multiple factors, and that's why the recommendations that the government has are addressing those underlying factors. It is not a genetic disease, and being an ethnic minority is not the risk factor specifically.